Good morning. My name is Erika Chavez, and I am a sales coordinator at the SmithLife Homecare. Welcome to the Ask the Expert series. For those of you who don't know SmithLife Homecare, we are a sister company with Chelsea SmithLife Communities, another trusted brand for elder care with over 110 years serving the community. We operate the Washington, D.C. and Montgomery County area. SmithLife Homecare as the Expert series focuses on providing valuable information and resources to our community while helping them age in place. Today, I'm here with our honored guest, Dr. Matthew Mintz. Welcome, Doctor.
Thank you. Good to be here.
Thank you. So, Dr. Mintz is a board-certified internist, expert on medical weight loss, concierge medicine, and now providing long COVID through functional medicine, which will be the main topic for our conversation today. Did I say it right, Doctor?
You said it right.
Okay, wonderful. So again, welcome, Dr. Mintz.
Thank you.
Thank you for being with us today and giving us the opportunity to know more about you and your practice.
Mm-hmm.
So the first question will be, Dr. Mintz, can you please tell us more about yourself and your practice?
Sure, absolutely. So again, my name is Dr. Matthew Mintz. I'm an internal medicine primary care physician. Actually grew up in the area and went to medical school and did my primary care internal medicine residency at the George Washington University and decided to stay on faculty for 20 years. So I was full-time faculty at GW, seeing patients, doing research, doing a lot of medical education, mostly with the medical students. And about 6 years ago, decided for a variety of reasons that it was time to work closer to home. So I opened up a concierge practice initially in Bethesda and now in Rockville. And so I have a primary care concierge practice. I have a small panel of patients. I've actually been closed to new patients in that part of the practice for the last year or so. But I also offer several other services that I do and that I am taking patients for. I do medical weight loss, as you said, and has been doing that for the past, I've been doing medical weight loss for probably 15 to 20 years, but recently opened it up to patients who are not my regular patients. I do ketamine-based treatments for treatment-resistant depression, which I've been doing for about 5 years now and seen some amazing results. Again, not for necessarily everybody, but for patients who one or two medicines don't just seem to work for their depression. There's been some amazing results with these kind of treatments. So I do. We just started doing clinical research, so I do trials of new medicines and things like that. So that's been fun and exciting. That's a recent addition. I do medical cannabis. I do certifications for medical cannabis for people who their regular medicines aren't working for things like chronic pain, anxiety, insomnia. Cannabis can be a really good option, especially for seniors. I have a lot of senior patients. The oldest patient I've ever certified for medical cannabis was 100 years old. So it can be a very good option. So I do all those things. And the most recent thing that I've added to my practice is functional medicine. And so I use functional medicine for a number of complex chronic conditions. And one that's we've seen lately is long COVID. So I've started treating patients with long COVID, but also can use functional medicine for a variety of other complex chronic conditions, such as fibromyalgia, irritable bowel, chronic fatigue, and again, long COVID.
Okay, so you already responded the second question. It was more about your services, so that's wonderful. Thank you so much. My next question will be then, we are going to focus today more on functional medicine. So can you please tell us more about functional medicine?
So functional medicine is a newer way of approaching health and disease. So if we look at conventional medicine, sort of the way medicine is practiced today, it's very focused on symptoms, diagnosis, and treatment primarily with prescription. So you have a cough or a cold, and so the doctor will give you an antibiotic. Or you go to your doctor for a physical and your cholesterol is high, and your doctor will give you a cholesterol medicine to lower that cholesterol. Or you have a heart attack and you go to the hospital and they do a procedure to remove the blockage and your life is saved. So that's our convention, that's our common sort of medical system. And it's very organ specific and very specialist specific. So a lot of patients will have their cardiologist for their high blood pressure and heart disease, and they'll have their pulmonologist for their lung diseases and their rheumatologist for their arthritis and so on. So that is our sort of typical conventional medical system, and it's done very, very well for a very long period of time. Just in the time that I've practiced medicine. I mean, we've seen dramatic reductions in cancer mortality and heart disease mortality, things of that nature. I mean, when I started early on in my training, we had the AIDS epidemic, and it used to be a life sentence, and now you can take a pill a day and live a normal, healthy life. So conventional medicine works well, but it works best for acute diseases, acute things. Like if you have appendicitis, you take your appendix out, or if you have a heart attack, you have treatments that are life-saving. But what most patients deal with, especially seniors, is chronic diseases like diabetes and emphysema and things of that nature, arthritis, and then and that doesn't, conventional techniques don't always work so well. We throw medicines at people and they see specialists, and it can help a little bit, but it doesn't work as well. And so what functional medicine does is it looks at not what drug can we treat for what symptom, but what's underlying, what's causing the arthritis, what's causing the diabetes, what's causing things like chronic fatigue and fibromyalgia. And so, essentially looking at the root causes of these diseases, addressing these causes can sometimes work much, much better than some of the conventional approaches. So that's really what functional medicine is. The understanding is that the body, we've evolved over time to survive. And so the body has a lot of mechanisms in place that help us sort of survive and help us stay healthy. And a lot of these chronic diseases, arthritis, diabetes, obesity, etc., are when these systems break down. So for example, inflammation. Inflammation is a good thing. If you cut yourself or you sprain an ankle, you have these inflammatory cells that come in, fix the problem. Hopefully they leave, problem solved, you're fixed. The problem is if you have inflammation that doesn't go away, like an arthritis, that can cause problems down the line. So often a lot of these chronic diseases are our body system's normal way of healing sort of stuck in a certain place. And so this is where long COVID comes in. The infection comes. A lot of people with long COVID, their infection isn't even really that bad. But the damage that the COVID virus causes, or primarily the way the body's natural systems respond to COVID, is this overwhelming response that doesn't seem to calm down. And so what we try to look at is, well, why is that? Why is this inflammation still persisting? And so that's what functional medicine does. It looks for what are the triggers or causes for these, for the body's healing systems to not work properly, and then how do we fix that? And what's also interesting about functional medicine is that while we can still use medications, a lot of the solutions to these problems are lifestyle things. Improved diet, improved exercise, stress reductions, vitamins, supplements, sort of more natural cures, or not cures, but more natural treatments to sort of help the body heal and resolve these things, often without medication. So that's, in a nutshell, sort of what functional medicine does. It can work for a variety of conditions, again, common conditions like diabetes and arthritis, but it's particularly good when we don't have a medicine to treat something, or we don't have a diagnosis. So something like irritable bowel, for example. Irritable bowel is a diagnosis of exclusion. There's no test that you can say that you have irritable bowel. Usually people go to the gastroenterologist, they do a colonoscopy, they do blood tests, they find nothing wrong, and they say, well, you have irritable bowel. And they don't have necessarily a treatment for it. And so that's where, a condition like irritable bowel or fibromyalgia or chronic fatigue, that these kind of conditions do really well with functional medicine, because conventional medicine, while it's wonderful for acute diseases, doesn't really have an answer. And so I've seen a lot of success, in patients with those kind of conditions where functional medicine approaches can really work really well.
So we can say that functional medicine focuses on the root.
The root causes of disease. Now, the other aspect too are the same root causes that cause disease, also cause aging. Mm-hmm. So, one way to we think of aging as sort of a natural thing, mm-hmm. but some of the complications of aging aren't necessarily natural and don't necessarily have to happen. Mm-hmm. And so there's your biological age and there's the chronological age. The chronological age is what the clock says, what the calendar says. You can't change that. You are your age based on your birthday. But then there's the biological age. Are you having arthritis? Are you fatigued? Are you tired? Are you not digesting properly? Things that we associate with aging. things do slow down over time, but it doesn't necessarily have to be that way. A lot of the things that, accelerate aging are these same root causes that cause the disease. And the way to address those are the same things: diet, exercise, stress reduction. And so there's been some interesting research recently. One, how to prolong biological aging so that you're, aging healthy for a very long time, or even applying these kind of approaches to something like dementia and Alzheimer's, where, trying to, there's been a couple of drugs recently approved for Alzheimer's where it's focusing on this one protein. And while they've been approved by the FDA, they have yet to be shown to work. All they do is they show where they lower this protein. We don't know yet whether that's going to improve memory. I'm not very optimistic because Alzheimer's is a complex disease. Dementia is complex. And so some treatments that have worked well is not one drug or one disease, one cure, but focusing on all of those things. And when you focus on some of these root causes of disease, some of these areas in which our body is not functioning the way it's supposed to, using a multiple discipline approach, changing the diet, changing the exercise, fixing issues with the gut, reducing inflammation, adding supplements, that type of approach in some recent studies have actually shown to reverse dementia and even reverse Alzheimer's. So it's a very fascinating field, which is why I've decided to start doing that in my practice. And so it's something that I've seen, I've just started doing recently, but I've already seen some amazing results.
We see that you take a few approaches to holistic approaches to medicine. So can you please tell me a little bit about what's the difference between integrative medicine and functional medicine?
That's a really good question. So if you ask a lot of functional medicine and integrative medicine doctors that same question, they'll probably give you different answers. I'll throw in lifestyle medicine as well. That's another term that's being used a lot. There's a lot of overlap between all of those things. So I will give you sort of my take on that, but I don't think there's a standard definition. So to me, lifestyle medicine is focusing on issues of lifestyle: diet, exercise, sleeping, not smoking, stress management. Those things are critically important to overall health, but also reversing some of these chronic diseases. And so that's very, very important. So I think functional medicine includes lifestyle medicine. Lifestyle medicine is a very big part of functional medicine. Functional medicine also goes a little bit step further to focus on what's happening at the cellular level. So what's happening in the body at an organ level and at a cellular level that stress reduction and sleep and good diet and exercise affects the body. And so often functional medicine doctors will do testing, will test various areas to maximize that. Functional medicine doctors often tend to use more treatments, specifically supplements and things like that, naturopathic treatments to help support the body, whereas lifestyle medicine will focus primarily on diet and exercise and things like that. So functional medicine, there's more supplements and testing and more at the cellular level. And then integrative medicine will incorporate some of those things. We'll also use what are considered alternative therapies that are not usually associated with Western medicine, such as
holistic.
So holistic is another term. So so integrative medicine will use things like acupuncture or Reiki or things like that. And so and again, I think there's a lot of overlap between functional doctors and integrative doctors, because functional medicine doctors will use some of those things too. So what's integrative and what's functional, is what's alternative and what's not alternative is actually changing over time. So I think there's a lot of overlap between those three. And then holistic medicine is really trying to look at the person as a whole, not just as what are your symptoms or what's your disease, but who are you, where are you in your life, and how can we treat you as a whole person and not just sort of in that disease. And you can be a holistic doctor and use primarily conventional approaches. One of the things about all of these things, or taking a holistic approach, is it takes time. You really have to sit down and take time with the patient and get to know them and get to know what's important to them and what are their goals or what are their values, what do they eat, How do they sleep? What do they do on a daily basis in order to see a patient as a whole? And any sort of a holistic approach, whether it's conventional or integrative or functional, it takes a lot of time to do that. And unfortunately, our current healthcare system doesn't allow for that. Most of my colleagues in primary care who take insurance, they see patients in 15-minute slots. And you can't really take a holistic approach when you see a patient in 15 minutes. A lot of patients who came to me, my regular concierge patients who came to me, from insurance-based doctors, they have a million specialists. Okay, why do they have that? Well, because their primary care doctor only has 15 minutes to spend with them. And so they send them to the cardiologist, they send them to the pulmonologist. So when I see a new patient, often one of the things I try to do is get rid of some of the specialists and try to, treat the patient as a whole patient. So I've always tried to do, holistic approach, and having a concierge practice has allowed me to do that. By having more time, it now has allowed me to incorporate some of these, more functional integrative approaches with my regular patients. And so I'm trying to expand that with other patients, who are just looking for a different approach to some of these complex chronic conditions.
Okay, doctor, I'm pretty sure all our viewers are getting excited as the same way I am, about functional medicine and being something really relatively new on this, on this field. Let's talk about prices. Can you please tell us about prices? So, because I know that it's not accepted by mostly insurance, they don't take.
That's a good question. So first of all, while I don't accept insurance, one of the things that I can do, and I currently do, for patients is I give patients invoices that they can submit to insurance. Now, unfortunately, it doesn't work for Medicare, but any other commercial insurance, if you have, unless you're an HMO, if you have a out-of-network benefit, you can submit those invoices and get reimbursed. So depending on patients' insurance and, their deductibles and stuff like that, a lot of my patients are able to get, some, if not all of the money back when they just submit it to the insurance. So I don't take insurance. I don't submit for patients, but if patients will submit those receipts, to insurance, often they can get, their, various, some of that reimbursed by their insurance company. Now, as far as, prices, it depends on what the service is. So for medical cannabis certifications, which I talked about, that's $250. Usually I can see patients as much as they want. Typically that's an annual visit. For medical weight loss, which I started doing, that's $1,000 a year. And again, that includes a comprehensive assessment in person, and about 4 other visits, which can be virtual or in person, and a year's worth of prescribing medicine and blood work, which is usually covered by insurance. So that's sort of a year-long package of $1,000. With the functional medicine, it takes a lot of time, as I mentioned, because you're doing a lot of testing, you're doing a lot of lifestyle changes. It's usual multiple visits, and so it's a much more time-intensive thing. So that's more. So for a functional medicine patients, that's $2,000 for a year. And again, we often see you multiple times, so we'll give you invoices that you can submit to insurance. There's not a set number of treatments for that. It's really what the patient needs. So it's a year's worth of emails and virtual visits and in-person visits and testing and all sorts of things. And so that covers patients for a year, whatever they need.
And usually the tests are covered by the insurance.
So it depends. So some tests are and some tests are not. So again, we use conventional approaches where appropriate and can do blood testing and urine testing and things like that. So all of my functional medicine patients, I do extensive regular testing. When it comes to some of these non-conventional testing to get at what's happening at the cellular level, sometimes they're not covered by insurance. Often they're not. So that's an extra fee. And sort of, we try to do whatever we can to get stuff covered by insurance, but often we need to do tests that are not. Medicare will cover some of the gut testing. Sometimes, interestingly enough, that's the one insurance that will cover some of it. But it depends. So the prices for the testing. And the other thing too is, as I mentioned, we use diet, we use exercise, we also use supplements. Unfortunately, supplements, vitamins, things like that are not covered by insurance. And so that can be, so it can be very pricey. It can be very pricey to take this approach. Nonetheless, a lot of the patients that I've seen, especially with this complex conditions, have seen lots of doctors and taken lots of medicines and have tried lots of things, and none of these things are working. So while it's an investment in your health, often it's a worthwhile investment, because you're not just trying to treat this particular disease. The goal is to get people in general healthier.
And good health has no price, right?
Good health has no price. It's priceless, absolutely.
Okay, Dr. Mintz, Before ending this interview, I would like to mention that we display more information about Dr. Matthew Mintz and how to get in touch with him and his team. So thanks again for watching our series today. Thank you, Dr. Mintz.
Thank you for having
being
me.
with us
It was
today.
a pleasure. Thank you so much.
Thank you. Taking your busy time. You know, I know you're really busy, and the fact that you came to our office and sharing this time with us. Thank you. Thank you.
Well, happy to be here.
Thank you. So, as Kathleen says, stay tuned for our next chapter of the Expert series, and bye.